All right, for more on this, Catherine Bennett is the chairperson of epidemiology at Deakin University School of Health, and she joins me now live from Melbourne. Thank you so much for joining us here on the News Hour. Now, nearly 60 countries have now issued restrictions or outright travel bans on southern African nations over the new strain, despite the World Health Organization warning against such measures. What is your take on how governments should move forward in implementing restrictions?
Well, we've seen a massive reaction, as you said, but we've also seen that even those measures put in place, even when they're quite hard border closures on people from that southern African region, we see that 28 countries now are reporting the presence of this variant. So these measures, including in Australia, were after some incursion of the virus had already occurred. It is about trying to slow it down until we get that really important information to help us understand what it might mean in populations around the world and what our current measures, including vaccination, but also even those standard measures we use to control outbreaks, our current quarantine measures and so on, we don't yet know if there are changes to the way this virus is transmitted. We see data out of South Africa suggesting that it is more transmissible, but we don't yet know whether that's because people have a high viral load, whether they have a longer infectious period, whether it's because they have more mild symptoms and therefore are out and about and don't realize they're infectious, shorter incubation period. There are all these possibilities. So most countries will be trying to just slow the movement of the virus around the world rather than thinking that they can actually stop it. Because if it's more infectious than Delta, we know that even the most tough border closures and restrictions can't keep it out, just as we found in Australia.
Definitely. And BioNTech's chief Ur Shahin says people shouldn't freak out about Omicron and that while vaccinated people might get more infected by the variant, they will likely be prevented against serious illness. Do we know how Omicron is affecting unvaccinated people at this stage?
We still don't know that. Where we've seen most cases in South Africa, their vaccination rates are still quite low. So it's hard to get that story clear about how it affects people based on their vaccination status, and how that correlates to age and all the other factors that we know contribute to the seriousness of illness with other variants. The first cases in South Africa were concentrated in university students. So they're people you would expect to see a more mild disease in anyway. But also, as you say, you need to kind of compare infection rates and the severity of illness based on vaccination status. So I think we're going to hear a lot more about this over the next few weeks. We've also got those travellers who are now distributed around the world, including some people who've picked up infections locally. We know there's been community transmission in Portugal. We know that recent Australian cases hadn't been in that southern African region. They, we think, might have picked up the virus in their travels home from where they were, which is another part of the world. So there's a lot to learn in these cases all around the world, which will include a lot more vaccinated people as well, so we can get that picture.
And we're likely to see more mutations emerge over time. Is this going to turn into a never-ending cycle? Is this our new normal where we're going to constantly be getting booster shots, staying more isolated than usual, especially when traveling, because we don't know when a country is going to close its borders? And I'm not even mentioning mask mandates. Is this our new normal?
Well, I think we're going to learn so much from this. If this turns out to be marginally more infectious, but not really different to Delta, then all those change settings will step down again. And I think next time people will perhaps not reach as far in terms of those border closures and restrictions, but try and get that measured approach. Because as you say, every time a new variant emerges, we have to be reactive. We have to learn quickly about what that means for us. But we also can't afford to keep going into this stop-start process and create that uncertainty. The really unfortunate thing about the timing of this, particularly for South Africa, they've just come out of a Delta wave, and now after only a month or two, now looking at a serious rise in cases again. But of course, it's also taken this variant to parts of the world in the Northern Hemisphere where we are seeing that winter rise in cases that we feared might happen anyway, now that could be fueled by the new variant. So, in the past you had flu seasons Now it looks like, you're getting transfers between the southern and northern hemisphere, which can mean we don't even have the benefit of those summer months where you have a bit of respite. So that's the worry. But the good news could be if in the long term the waves start to become more gentle, if in fact you might see cases, but the illness is less severe. Maybe it's
Right.
not this variant, maybe it's the next one. That's where we might be able to live with the virus and eventually get to a point where it is something more like the seasonal flu than a
Hmm.
pandemic flu. We'd like to see that with COVID too, obviously.
Hopefully, Catherine Bennett, thank you so much for joining us here on the News Hour. It was a pleasure having you.